Welcome to CogX 2021. My name is Sonia Barlow and I will be your MC for today. The last 18 months have been life-changing and I'm glad to be hosting the Lab to Life stage, a concept particularly close to my own story from theory to the real world. At the start of Jan 2020, I left the corporate world and started on my own mission to take my idea into a real life business. I started two businesses, one, a not-for-profit like-minded females, aka LMF network, and two, SB Consulting, a diversity and inclusion and business consultancy. In the last 18 months, despite the pandemic, despite tech failures, despite being on Hopin the whole time or other networks and online platforms, I've succeeded to run both these businesses, creating the largest mentoring program the UK has seen with over 600 participants across 14 countries to enable women into tech and digital, delivered over 500 D&I training workshops to businesses around the world, written and published my first book titled Unprepared to Entrepreneur, missed out on Forbes Under 30, however achieved my own radio show on the BBC Asia Network titled The Everyday Hustle. Everything I've achieved was once an idea, simply an idea that existed that I was wanting to turn into a major innovation. And that is what the businesses of today are. Every major innovation started as just an idea. Artificial intelligence was one of them. One company learned from another, and almost every business uses AI in some exciting way. And the learning continues. From fintech and cybersecurity to gaming and education, we feature the companies creating the best and the boldest AI-driven technologies and hear from the clients implementing them in the real world. With eye-opening examples and so many case studies, we invite today's most forward-thinking companies to showcase their outstanding achievements and the challenges they bumped into the way. The CogX Hybrid Festival 2021 will incorporate virtual sessions such as this and in-person sessions at King's Cross. So hi if you're there and you're watching, as one of the largest, if not the largest, global leadership summits and festival of AI, transforming technology. And we're asking the question, how do we get the next 10 years right? So as we begin, that's the question I'd love for you to answer. For a quick introduction in the chat function, please introduce yourselves, your pronouns, where are you joining us from, and how do we get the next 10 years right? Before we kick off, I'd like to thank our partners Accenture, BT, Quantum Black, and Visa, with support from Shell Big Innovation Center. And remind everyone that we are aiming to go viral. So remember to take pics and tag at CogX_festival with hashtag CogX 2021. And if you'd like to tag me, I am at Sonia Barlow UK across all platforms. I'll be your MC for the whole day, so feel free to get in touch with me, to use the chat function, to come to the LMF Network booth, and anything I can do for you, let me know. So let's kick off our first session, how the NHS is using AI to predict demand for services, moderated by Laura Stevenson, the Senior Manager of Health and Life Sciences at Faculty. Remember to tweet at CogX_festival with the hashtag CogX 2021. Over to you, Laura.
So the COVID-19 pandemic needs absolutely no introduction. The scale and complexity of challenge it created was, to use the 2020 word of the year, unprecedented. I won't pretend to understand the breadth and depth of the NHS's response. It was really complicated and it was really nuanced. But I'm quite positive that it was in many ways quite incredible. Today, we are going to cover a small but crucial part of that response, the COVID-19 early warning system, a first of its kind capability that forecasts vital metrics such as COVID-19 patient admissions to hospital up to 3 weeks in advance. We're going to discuss why it was needed, how it works, the impact it had, and importantly, some reflections on what was hard, what led to its success, and how these learnings might be applicable for others using AI in the real world. First, some introductions. My name is Laura Stevenson, and I work for an AI technology company called Faculty. I've had the pleasure of leading the team that developed the early warning system in collaboration with the NHS over the last year. So hopefully in a second, I'll be joined by my co-presenter, so Dr. Harrison Carter. He's a clinical fellow at the National Medical Director for NHS England Improvement. His day-to-day role is working in emergency planning and incident response. And he's worked really closely with myself and the team on the early warning system. So not that anybody wants reminding, but let's set the scene a little bit more. Harrison has experienced the pandemic in two ways. So one, in his current central role in the strategic incident response team, and two, as a doctor in a hospital. Across the board, hard decisions were being made every day. Where do we send vital equipment? How do we manage a system responsible for the health of millions of people in a global pandemic? How do we provide strategic direction in a dynamic scenario with incomplete information and in the context of intense media, political, and public interest? Working across the health sector and indeed daily with government, there was a lot of stuff going on. And the stakes were never higher. The impact was exceptionally high. At the start of the first wave, I think it is fair to say that the NHS were operating a little blind, and it was exceptionally difficult to predict the demand on health and care services as a result of COVID-related activity, or spot which areas were most at risk. We're going to be most at risk next. So this presented new types of problems for the NHS. Existing management information flows, of course, existed, but these were built for the world of BAU and were not sufficient. They needed real-time information, a single source of truth on the current situation, and the best possible forward look of what was going to happen next. Much of this information was already captured across the system, but staying ahead of the virus needed this all to be brought together. And in a crisis response, inconsistencies in data or slow, disparate processes could have cost lives. This was no easy feat, and in the early days of the COVID-19 pandemic, several technology companies joined forces with the NHS to support the effort. This coordinated data response enabled a lot of things, one of which was the early warning system, which we're going to talk a bit more about today. So what am I actually talking about? What is the early warning system? I'm going to jump into some of the details next, but at the very highest level, it's about forecasting COVID-19 patient admissions and bed usage in hospitals for staff within the NHS to use. This was and still is a really hard thing to do. So as I've said, it was a rapidly evolving situation. The data landscape was initially very sparse, and decisions needed to be made at all levels. Historically, trying to forecast what might happen at the trust or local level wasn't really done, and existing models tended to be deterministic in nature, making them tricky to adapt when the situation on the ground was changing so quickly. And of course, the dynamics of the disease change, people's behavior has changed, the context has changed, populations across the country are unique. It's a very, very hard challenge. Okay, so a bit more detail. The early warning system is a set of models that forecast COVID-19 patient admissions and different types of bed capacity 3 weeks in advance. These forecasts are made at the national, regional, and trust level. This equates to roughly 500 forecasts a day now for over a year. So the example screenshot I have on the slide here is the admissions forecast for England from a few weeks ago. The pink area in the circle is the forecast forward, and the blue area shows the historic curve. These models use a range of data. Crucially, information about current admissions or bed usage, so the data points in the blue section, are key inputs to the model. But we also use leading indicators, so things that are more upstream indicator of COVID impacting hospitals, so such as COVID testing, NHS 111 service usage, and openly available mobility data. So a bit about the techniques we used. We use a technique called Bayesian hierarchical modeling, and this is really, really well suited to the challenge at hand for a few reasons. So the hierarchical nature means that you can capture the hierarchical nature of care within the NHS, so trust within regions and regions within England, and allow relevant information on what is happening in one area to be used in the forecast of another. This is a very efficient way of using information. This was especially powerful in the earlier days when there was much less data available, and continues to be really important for forecasting small local trends. So the Bayesian nature means a couple of things. So firstly, the forecasts account for the uncertainty of the system that they represent. So you get a range of possible outcomes and their associated probabilities. Put even more simply, you get really useful confidence intervals or error bars, and that is what the pink area is showing. So this helps with worst and best case scenario planning. So taking the upper bound of the pink area, you could make statements such as, with 95% confidence, I don't expect COVID admissions to exceed that specific number on this specific day. And then given everything else I know about the world at that time, how much capacity do I have left? And therefore, how does that impact my plan? Secondly, the Bayesian nature means you can incorporate expert knowledge into the priors of the model and update them as the world changes. So essentially what this means is you can use information from experts across the system to give the model a very small set of assumptions about the future shape of the admissions curve. And these will get increasingly superseded as the more data comes in. This means you can forecast turning points or upticks really well, much better than more simple models are able to do, such as doubling rates. So these models were embedded into a dashboard in a way which makes it easy to identify and surface the areas which are most at risk. The screenshot I have here is again from a few weeks ago, but what it shows is essentially a sortable table of trusts, with the trust which has the highest COVID admissions forecast at the top. Users could then click into each trust and take a look at that forecast of interest, and then focus their planning or mitigations or actions in these areas. So building the models and building the dashboards is one thing, and it's definitely really hard, but embedding it into operational workflows to help decision makers was a whole other challenge. And this is where you actually can have the impact with these kind of tools. I'm sure any product person, of which I'm sure there are many in the audience, would laugh me out the door if I start making generic statements about the importance of talking to users and learning from them. But I have 3 points to make in this space. So firstly, why is the model forecasting that is always going to get asked. Users need to be able to connect this forecast to all the other dots that they have, their intuition, insights, local information, like build up a coherent picture before an action or a decision is made. To meet this need, we built and deployed faculty's cutting-edge explainability technology into the tool. Shown on the screen here is what a user would see if they click to explain the button forecast. Again, this is from several weeks ago now. From the chart at the top of the screen, you can see that at this point in time, the daily admissions forecast was trending down. What the table below shows you is how much each of the inputs into the model was impacting that output. So let's take the top row. We can see that daily admissions from 3 weeks ago was causing the forecast to decrease, and by quite a big chunk. But then in comparison, if we look at how much Pillar 1 and Pillar 2 testing data was having an impact on the forecast at this time, you can see that it was very little. In the tool, users could actually also click into each of these rows and see for themselves the bit of that data which was using to make the prediction. So you could click there and see the testing data. These forecast explanations allowed users to see and understand what the most important drivers of a forecast were at any given time, which ultimately provided additional situational awareness and nuance beyond the forecast alone, allowing decisions or responses that were being informed to be even better. This level of transparency really helped with adoption of the tool. So I'm not going to get into any more details of the technology here, other than to say this is underpinned by some of the work developed by faculty's research and development team. It uses Shapley values and allows causal relationships that are evident in the data to be incorporated into the explanations. If you're interested, they have published several papers on AI safety in peer-reviewed journals. So secondly, users need to be able to trust the tool. So the models have to work, and users need to be able to see that they work. As a data science team, we rigorously test and validate performance of the models all the time. But this behind-the-scenes monitoring is not enough. So we built a model performance tab in the tool. This allowed users to see aggregate statistics on how well the models were performing. We also built kind of functionality to allow users to scroll back in time and see old forecasts and how the data has come in since. And this is what I'm showing on the slide here. So the pink area is the forecast made on a day in the past, and the white dots underneath show how the data has come in since. This allowed users to say, if I used this forecast 10 days ago, what decision would I have made, and would it have been the right thing to do? Then thirdly, we ran daily briefing meetings with central and regional teams to talk through what the forecasts were showing and what we recommended looking at specifically that day. This allowed for lots and lots of in-the-moment discussion, questions, quick clarifying of understanding of what was happening and why. And of course, it gave the development team loads of challenge and loads of feedback. Ultimately, this resulted in a group of real super users who had a deep understanding of not the models themselves, but how to interpret the forecast and how best to use this information to support the hard decisions that they were making. So unfortunately, Harrison Carter is having a few technical issues, so he's not able to talk through the impact from his perspective, but I'll have a go for him. So there are kind of three key things of where the impact is most important. So the ability to just respond in real time to short-term pressures in hospitals across England was really, really powerful. Not only was it about kind of forecasting upticks or like turning points or like places where pressure was going to be, but when in times of low COVID, having the confidence to press ahead with elective care, especially in the summer 2020, was really, really powerful. And finally, the lasting impact. So kind of data has always driven like operational decision making within the NHS, but this is a new type, and there's loads and loads of stuff. There's loads more stuff that can be done to make this even better. The statement of 10 years of progress in 10 weeks is thrown around a little bit, and it's a nice summary of the impact that's been had. It's important to note that this is not about making the difficult decisions any easier. People are always going to have to be involved. So finally, to summarize a few reflections and things to think about for the future. Firstly, really truly incredible things can be achieved when the focus is like laser sharp and the right expertise can come together. The pandemic has enabled innovation, and successes in this space should be capitalized on, particularly the power of machine learning in operational workflows. In collaboration with the NHS, we are currently exploring where else these techniques could be applied to support important challenges. I personally have been lucky enough to deploy sophisticated machine learning systems in organizations ranging from energy trading houses to retailers. And the implementation of this technology at scale unquestionably makes the NHS one of the most sophisticated users of data and AI in the country. And that is an incredibly exciting place for them to be. Clean, organized, single source of truth data is an amazing enabler. Without this, teams struggle and inefficiencies can run really deep. Models are great, but answering the why questions with explainability tooling makes them much better and much safer. Trust in models is essential. This has to be earned, and performance has to be transparent. Spending time with users to enhance and clarify understanding, distill information, and sometimes just have a chat about how they were using the tool is really crucial for true implementation of AI solutions. That ultimately just requires a lot of talking and a lot of listening, but developing these super users is a really powerful way to scale impact. I would like to make one final thing clear. This is not about automating decision-making. The gravity and nuance of decisions that are made in the healthcare space is so large. It's about giving expert humans who are making expert decisions the best information to do their job. And this is where AI can really help. Thank you so much for listening. I would be delighted to answer some of your questions, which I think I can look at in the chat.
Thank you so much, Laura. Very interesting concepts. And I love the way that you've ended with the future learnings of implementing AI. especially that the user engagement is key. And as anyone and everyone who runs a business, as we're talking about going from lab to live, I mean, user engagement is so fundamental. So you know what you're building, you know what the public wants, and it feels represented as well as something that they will take up. So amazing that you've been able to share such interesting points with us. I would like to apologize for Harrison, as Laura mentioned, not being able to join the session due to technical difficulties, though I'm sure we've all been there. And I encourage you to find Laura and Harrison online and connect with them on LinkedIn. We do have some time, so we will be asking Laura some questions. Please feel free to share them along in the chat function. And Laura, and I'm sure you can see them coming through. So if you'd like to pick the one that you would like to answer, please go ahead. And I'm happy to share others that come across as we are in this discussion.
Yeah, totally. I'll go for a couple of them. So hi, Laura. Could you share your thoughts on what the biggest challenge was with getting traction with the tool? So I think I touched on this a little bit, but like ultimately it's about trust and transparency. So kind of the explainability tooling which we deployed was really, really powerful in that instance. And I think so AI safety as a topic more generally is like quite rightly very kind of present at the moment. And I think basically like one of the core challenges of making AI safe is about making it explainable. So that was one thing. And then secondly, I think going back to the point I was making around transparent model performance, I think there's a lot to think about in this space about the best way to present model performance in a way that it's easy for people to understand, but also helps them build trust. Let's see, another question. So someone has asked, how do you account for kind of the changing context or like changing like shape of the world, such as new variants or vaccinations? So I think this is a really, really important question, and it highlights really nicely why one of the reasons why forecasting COVID is so difficult. Ultimately, these models are data-driven. They rely on trends in data to forecast what is going to happen next. But the Bayesian nature means that you can have a very small set of assumptions which can be included and updated a lot. And this is kind of like giving the model some prior knowledge of how the world might change based on what the NHS or other experts are learning. So basically, but also means that you don't let the model let those assumptions override any trends in data which are observed. So that is how we did it. We iterated a lot with the NHS on the best way to incorporate, and we like continue to work really closely with other modeling teams who have like a good sense of what is happening. And then maybe if I take one more question. So I can see this being useful for flu, COVID, but what about other things? So I think like forecasting things within the NHS like has to be exceptionally useful for operational decision making, or just like operational workflows more generally. There's a lot of as hopefully the NHS kind of goes into more of a recovery mode over the course of the next year, like having the best possible view of the various types of demand which are going to be present is going to be like really, really powerful. I think I've answered most of the questions there, Sonia.
Yes, absolutely. The final question, if you would like to answer, is what is the biggest challenge that you're experiencing right now?
So with regards to the kind of ongoing running of the early warning system, well, like I think it's a fairly obvious statement to make that we're in like an incredibly uncertain period at the moment. So kind of the ongoing monitoring and maintenance of models in production is always going to require a team to sit behind it. And in periods of time when there's like lots of stuff happening as there is now, making sure that we are like leaning in and providing enough attention or plug in enough to what is going on in the world.
Thank you so much for sharing, and thank you so much for just kind of doing this when there were technical difficulties. There were, it was kind of a couple of minutes that we had to really sort out the work that we do, and it just proves the power of technology and what people and humans can do when they need to adapt, right? So Laura, thank you so much for joining us. Please, can you tell everyone where can they find you and connect with you, be that LinkedIn, Twitter, and any other platforms which you may use?
Yeah, LinkedIn is best. Laura Stevenson, that'd be easy to find.
Amazing, thank you, and thank you so much for joining us.
Thank you, Sonia.
Absolutely. Thank you so much. We shall be taking a short break. Our next session starts at 11 a.m. At 11 a.m., if you could join us for Collaboration to Innovation, how Porsche Motorsport sharpened their competitive edge with AI, curated with McKinsey & Company and Quantum Black, moderated by Zara Davis. We will take a short break now and be back at 11 a.m. In the meantime, I do encourage you to network with others using the networking room, get in touch with other expo booths, and join the other sessions which are live. And really just enjoy this day. So thank you, and I'll see you back at 11 a.m.